With inflammatory bowel disease or all autoimmune diseases, I found a big connection between wheat products and also dairy products. So one of the first things I tell people, I said, whatever you got to do. I mean, I know your protocol and I tell them a lot of similar things, but you definitely stay away from wheat and dairy products because this will bring on an attack or cause an inflammatory thing. So,
Let me just say that fried foods are worse. Fried foods are
right.
the You go to fast food restaurants, you eat fried chicken and French fries and fried devil dogs and donuts, and you can't expect to have, you're gonna damage your gut. And you damage your gut when you don't have an autoimmune disease when you eat those foods, you know.
Yeah. Absolutely, absolutely. So what do you do? Like I know it's individualized, but you also got to look at a person's, their demeanor and where their understanding is. But people contact me all the time with inflammatory bowel disease. And it seems now more than ever, believe it or not, Dr. Fuhrman, they're from India. A lot of people are contacting me from India more than ever before with inflammatory bowel disease.
Really?
And uh, I mean, what's the first thing you tell them, like if you're going to do anything you got to do this, or there are particular, sometimes I find now that I didn't know back then, was there certain supplements that can, I find, somewhat help people uh besides diet. But what do you tell people? Of course you get their history, what they're doing and all that, and then you tell them what they need to stop doing. But is there something that across the board, I guess fried foods is your answer. You tell everybody right across the board, you got to give up fried food or I can't work with you or something like that.
Oh,
What do
no
you?
way. That's for sure what you just said.
Yeah, yeah,
I'm not going to treat a person who's eating fried food, but
yeah.
but of course they the greens have the substances to normalize immune function. And I tell people if you're not going to eat green vegetables, you might as well live close to a hospital because you're not going to recover without a high green diet. So we're using greens pureed into green smoothies. We're juicing greens. We're making them into soups. And when they first start, and most people can still tolerate green juices and green smoothies where they don't have to be all raw and they don't have to avoid raw food unless they're really having, heavy bleeding. You know what I mean? So we basically have them on a vegetable a mixture of raw and cooked vegetables with lots of greens as the greens is the therapy for bowel disease. That's the main therapy, a high green vegetable diet. And the same thing with the irritable bowel syndrome, which we didn't talk about, which is just gas, which is bloating and gas, which is mostly because people overeat food and they eat and extend the capacity of their digestive tract to adequately digest food. So they're used to eating till fullness. They distend their bowel. They don't have enough enzymes to adequately digest what they're eating. And they chew so poorly that they don't produce enough endothelial growth factor and ptyalin in their saliva. And they don't not showing enough greens that produce enough nitric oxide in the mouth. So without the nitric oxide, without the bacteria produced in the mouth causing production of, and without the endothelial growth factors in the ptyalin, it irritates their bowel. Their bowel becomes very easily irritated, and they can't digest food well. So they've exceeded the capacity of their bowel to adequately digest for so long that the bowel has lost its capacity to digest properly. Like the beta cells in the pancreas lose the capacity to produce enough insulin after overusing them for so long, requiring the body so much insulin, they start to poop out. Well, your digestive tract starts to poop out in its digestive capacity. And then people get diagnosed with small bowel bacteria overgrowth. They go to doctors. Doctors give them antibiotics and give them all. So doctors just screw them up more because instead of getting them eating more reasonable sized meals that are easy to digest and have them focus on learning to liquefy food in their mouth before they allow it to be swallowed and chew how to get well, they just try to get them on the remedy mentality with trying to kill bacteria in the gut, which just cycles them back through. Now you got more yeast, and now you got all bad bacteria. Now you got it all over again. And you feel better for a few months. Now you're gonna feel sick again. So yes, it takes. In any case, here's the message that we're giving people is it takes diligence and persistence in careful and excellent lifestyle habit to earn back good health in a permanent way. The remedy mentality where you're looking for a pill or a magic substance to get you well is not that effective, even and especially with irritable bowel syndrome, people with chronic bloating and gas. They have to, so they have to be willing to make the dietary changes to eat very healthy foods, you see, most Americans, they get used to sucking down like scrambled eggs and meats, and they get used to
Sure.
sucking down yogurt and cereal and stuff that doesn't and white bread that doesn't require much chewing because the stuff is already have little fiber and is already cooked,
Yeah.
and so when you switch to a diet with a lot of roughage and fibers, it requires a lot of chewing and mixing and
Forces you to, yeah.
liquefying, and a lot of people's digestive tract, it doesn't have the buildup of the healthy bacteria, the thickened biofilm, the right level of enzyme production. They don't have the capacity to handle all the, so they go back to eating a diet. Oh, I went back. I feel better if I just eat eggs and yogurt and eat lamb chops now. I went off eating all those vegetables. I feel worse. And that's going to make them die of a bad. That's going to make them temporarily feel better, but it reinforces the bad diet, and they can't ever digest a bean. So we do it a different way. We take time to chew real well and train their body to build the right bacteria in the gut and gradually have them earn back the capacity to digest roughage, salads, cooked beans. And so by giving them, I might give a person a teaspoon of beans with every meal, chewed real well to a liquid rather than take them away, because you're never going to learn how to digest them and to produce the enzymes and bacteria to degrade them if you're not chronically exposed to them. So something, as opposed to removing it from the diet, of course, we're cutting it back to a small amount, but we're giving it with every meal 3 or 4 times a day, not taking it out of the diet. They make things worse. So people go to the doctors too. They'll go to these alternative doctors and get these like blood tests to show they're allergic to all these foods, and they're not allergic to them, and they're avoiding these foods, which don't really make them better. They just make them develop more allergies to other foods now, because
Yeah.
it's more digestive intolerance, the IgG. It's not a real allergy like a RAS test or an IgE allergy where you would have your throat close up or your skin rash. It's just digestive intolerances.
Sure. What about probiotics? Do you ever recommend probiotic supplements for people in these situations?
I do, but judiciously, because probiotics don't take the place of building your own diversity of the healthy bacteria. So you can't build back a healthy microbiome with probiotics or with even fermented foods. We have to do it by eating some raw green vegetables and some onion or scallion in there, chewed real well, and some cooked mushrooms and cooked beans, including a little cooked soybean. We do a better job at building a microbiome if we do it with food. And then we could use some fermented foods. I prefer to use the ferments that don't contain salt, like, for example, a fermented wheat germ extract or a fermented soy drink that's made with nitrogen fermentation, and there's no sodium in the product at all. So rather than using kimchi and sauerkraut and stuff where they use salt, and I don't. It's bad to be on those. Salt can also cause inflammation in the gut too. And so yes, we can use some ferments, but mostly we're doing it with. In other words, we're using those things without eating the right food. It's not going to stick. It's not going to live. It's not going to hold on to the villi and form a nice biofilm. It's mostly your biofilm as the result of the healthy diversity of fibers in your diet. And we're training people to grow a wide diversity of bacteria, not just take the ones in the probiotic, to grow a wide diversity with a lot of different types of food fibers that now you can digest because we strengthened your digestive capacity.
Do you do any sauerkraut or kimchi yourself personally sometime?
Absolutely not.
No, because of the salt?
Correct.
Now, there's a company that makes kimchi with no salt. A raw
Hmm.
food company, I think. They
No,
do that.
that's cool. Yeah, I'm not
Yeah.
aware of that, but if that was, I would have no objection to that if that was the case.